Mater Hospital welcomes you to its newest satellite medical center at the Well Mall along Langata Road in Karen.
The reason why clients should come to Mater Karen Clinic or Medical Center is because we offer a variety of medical services to include consultation services which are done by our qualified and experienced doctors.
We manifest the spirit of Christ in the provision of healthcare to all our patients as we adhere to the values of the Religious Sisters of Mercy.
We provide basically primary healthcare services. So this means we'll follow up patients on an outpatient basis for various diseases, including diabetes, asthma, and any other illness which arises, which does not require complex care. Our staff are qualified and provide effective services which are cost effective and good for our patients.
The various services that we offer at our clinic include pharmacy services, where we have a fully stocked pharmacy run by a qualified pharmacist, and we serve all your prescription needs. We have laboratory services that are run by our qualified lab technologists.
Get more than just basic treatment at Mater Hospital Karen Medical Clinic.
One of the key features of primary care is that we provide health education about various conditions. This would include things like hypertension. We would advise you on things such as how to take care of your health.
We serve our clients within a very short time. We have enough well-ventilated waiting area for our clients. And we have rooms for all those procedures that we've mentioned, well-spaced rooms with enough facilities and equipment. We also have all the decentralized services that are offered from the main hospital, to include ultrasound services that we offer on Wednesdays from 8 a.m. to 5 p.m. in the evening. So feel welcome to Mater Misericordiae Hospital, Karen Medical Center.
We take pride in your wholesome well-being. We are always ready to meet you at your point of need.
A lot of health issues are now preventable, and this means that just by making lifestyle changes, we can improve the health of people in the community.
Our esteemed clients and patients, welcome to the Mater Misericordiae Hospital, Karen Medical Center.
We have a large, well-ventilated facility, which means that we are able to see patients in a safe environment. And I would ask you, if you have a health issue and you are within the area, please feel free to come and consult us. We're happy to work with you and identify your issue and resolve it.
We are open every Monday to Friday from 8 a.m. to 7 p.m. and every Saturday from 8 a.m. to 5 p.m.
You come and support us in this medical clinic in Karen, in the Well. We are in the first floor. And you just test us. Sisters of Mercy are known for quality because they are all over the world, and especially our care for the sick. It is hard times because of the coronavirus, but we know we will give the best quality.
We just want to welcome all of you to come to our gynae clinic. It runs every Tuesday from 9 to midday. We have the full gynae specialty, all located in one room, one roof. We have a very comprehensive lab. We have ultrasound services, and most of all, we have caring staff who are going to take care of all your needs. So once again, welcome and karibu to this great medical center of ours.
A very good morning. Thank you for tuning in to this live discussion with me, Maureen Kimani. And this program is brought to you by Capuchin TV in conjunction with Misericordiae Hospital, just to help you know much more better when it comes to health matters, either yours, your friends, or even your family. And that's why we bring this discussion every Friday from 9 a.m. right here on Capuchin TV. And today we shall be talking about hypertension, and some people call it silent killer. I'm sure you want to know why is it referred to as silent killer. And just to give you a brief history, and an estimated 1.13 million people worldwide have hypertension, or even much more. We shall get to know much more better from our doctor from Misericordiae Hospital. He will be introducing himself, and he will be telling us much more about this hypertension. And in case you want to send your feedback or any question concerning our topic today, you can write an SMS, or you can even call 0717, that is our office number, 0717 424 866. And also you can interact on us on our FB account, that is Capuchin Television, and also on our YouTube. Welcome to this discussion. Hi, Doctor.
Good morning.
Good morning. How are you doing?
I'm okay. Yes.
Good to have you here in our studio.
Thank you very much.
Maybe you can introduce yourself to our viewer, saying your name and what you do in Misericordiae Hospital.
Well, Maureen, my name is Dr. LANGO BENARD. I work in accident and emergency unit of Mata Hospital. I also visit the renal unit, where we dialyze the patients who have complications from the high blood pressure that we're talking about.
Thank you so much for coming. And talking about blood pressure, and you can tell us what is hypertension and why is it referred to as silent killer?
Yeah, so hypertension is, we define hypertension as abnormally high blood pressure. That means we have to know what is normal blood pressure. Normal blood pressure for an adult that we are interested in today is when your pressure, the pressure is measured in two parts. There's something called systolic blood pressure and called diastolic blood pressure. So when they're recording your pressure, you'll find they put a figure up, then a figure down as well. Okay, so the figure up for an adult is supposed to be between 100, okay, up to around 138 for an adult. That one we say the pressure is still good. Okay, then the lower figure is supposed to be between 60 and probably around up to 81, 85 or 89. If your lower figure reaches 90, then you start saying that you have high blood pressure for an adult. If the upper figure reaches 140, then we start saying that you have high blood pressure. And we say it's a silent killer because you're not going to reach these figures, and then it sets an alarm for you, okay? Because it doesn't tell you you will have no symptoms basically. When you reach the hospital, we shall record your blood pressure, and then we surprise you that your pressure is high. You see that? So you might have been having this for so many months or even years without having any symptoms. That's why we call it a silent killer. Yeah. And
in my introduction, I talked about the estimated figure that is 1.13 million people worldwide have hypertension. How common is it in Kenya?
Yeah, that's very important. The public should know that if you don't record your pressure, you will not know that you have high blood pressure. That is the starting point. And in the hospital, every time patients, we are having increasing number of patients whom we record their pressures and we realize they're high, okay, which are just incidental findings without them knowing that they have high blood pressure. They'll come to the hospital for some other reasons. There's been a lot of studies around in Kenya, okay. The recent one has been done by a gentleman called Elijah Ogola and his colleagues. This study was done between 2017, I think, up to 2019. It has been even published in European Heart Journal. They studied around the routine screening of patients outside the hospital settings. They found about 14,800 clients screened, adults. So they found that about 24 up to around 24.5% of the adults that they're screening in the general population have high blood pressure. Unfortunately, of about half of these people who have high blood pressure, whom they found, they are not aware that they have high blood pressure. Okay. Then, of the ones who are aware that they have the high blood pressure, who are taking medications, almost half of them, about 45.5% of them, their pressures are still high, not even controlled on medication. So you can see the burden of high blood pressure in Kenya. Okay, and this is on the rise. Okay, every day, every year is getting much higher.
Why is it on the rise?
Yeah, so it's on the rise because high blood pressure, the one which is the commonest type, is called primary hypertension. Primary hypertension means that we don't have a direct cause of your pressure going up. Your pressure is going up because of a combination of so many things. Number one is that your lifestyle, the routine lifestyle, that what you wake up in the morning, instead of going to jog and do some sweatings to get fit, you jump into your car to go to drive for work. You drive for work, you sit in the office. You sit in the office the whole day, you go back home driving, then you reach your house, you sit down to watch TV and eat food, then sleep. That's our common lifestyle. We have started going away from the routine, from the lifestyle they used to have those days of going to the garden, we dig, we get the fitness as much as we're looking for food and looking for money. So the lifestyle is so sedentary these days, okay? We are not even aware that we are living sedentary lifestyle because it's our usual work style. You go to the office, so you sit and work. So we don't know that our lifestyle is so sedentary these days. Number two is that our diet is getting worse and worse every year. You can see most of the families these days, they have, at least on routine basis, they are having some high calorie diets they're taking in their houses, diets which have a lot of salt, diets which have a lot of animal fats in them. Okay, more and more people are gaining more weight. They're becoming overweight or obese these days. So a combination of the diets that we are having and the lack of exercise that we are having is making high blood pressure become more and more common. Okay, because we know the mechanism by which this comes. When you combine this lifestyle and the dieting, then you're going to have a lot of fat deposits in your in your blood vessels, and the blood vessels will not keep increasing in the diameter, but you keep blocking it with with the fats which are accumulating there. So it keeps narrowing the lumen of the blood vessels. So when you narrow the pipe, then the pressure of the blood flowing in these pipes starts to rise up. Okay, slowly, and with time it gets to critical levels. So this is why we're having increasing levels of the incidence of high blood pressure and also the prevalence of high blood pressure. Okay.
And what are some of the types of high blood pressure?
Yeah, well, there are so many types. There are basically two types of high blood pressure. Okay, we categorize them as primary hypertension and then secondary hypertension. Primary hypertension is what I've been trying to discuss, that it's basically our lifestyle, and which is about 90% of high blood pressure, okay, in adults. About over 95% of high blood pressure in adults is this primary hypertension, which is due to our lifestyle. And then there's what we call secondary hypertension. Secondary hypertension comes because of specific diseases which are making the pressure to go up. Okay, an example is when you have a kidney disease, okay, chronic kidney disease, then your kidney is failing to regulate the sodium in your body, what we call salt. When you retain too much sodium in your body, and then you also end up retaining a lot of water in your body. Okay, when you retain too much, then the volume of blood increases. So when the volume of blood flowing in the pipes increase, then your pressure is going to rise up. This usually come very, very sharply. Okay, they don't come so slow, they come sharply. We have so many things, sicknesses like people have blood vessel disease. The blood vessels are getting inflamed, what we call vasculitis. Okay, you tend to have increased number of inflammatory mediators in these blood vessels when they're getting inflamed. So some of these makes us retain so much fluids. Okay, these fluids increase the volume of blood, and then you start having what? Start having pressure going up. Then also it makes the blood vessels get more and more narrow. There are so many sicknesses, like people have adrenal glands. The adrenal glands are so small glands which are around the kidneys. Okay, these adrenal glands, when they have any problems, they start secreting some hormones, which these hormones makes our pressures to go up. Okay, things like people have things like hyperthyroidism. Okay, your thyroid disorders. These people have hyperthyroidism. They tend to have increasing pressures. Okay, people have in pregnancies. People have what to call preeclampsia. You've seen the mothers who come to the hospital when they're measuring their pressures during pregnancy. They start realizing that their pressure starts to rise up. Okay, normally from around 20 weeks of pregnancy. Okay, the pressure starts to go up. Those are because of some specific things which are taking place in the blood vessels. Okay, during the pregnancy, which tend to predispose them to start having rising blood pressures. Okay, so these pressures which are rising because of specific sicknesses are grouped under what? Under secondary hypertension, because we can identify what has caused it. Then we can try to correct the causes, and then these pressures tend to be cured. But the ones which are primary hypertension, which are due to your lifestyle, you are going to likely stay with it for life. Okay.
Okay, talking about the lifestyle thing, we know so many people right now, they have sedentary lifestyle. What can you say, how do I even know, like I have a high blood pressure when it comes to some of the symptoms? Because we can see ourselves spending much of the time in the offices. So what can you say about that? What are some of the symptoms?
Oh yes. Now the problem is that it's not going to warn you. When you have high blood pressure, it's building up slowly. It's not going to warn you. It's not going to realize anything. Most of the time, people have no symptoms. People get symptoms from high blood pressure. People whose pressures have risen so high, and by that time, it has taken so many months or years. By the time it's starting to give you headaches, giving you some dizziness, chest pains, abnormal heartbeats. Okay, maybe you'll come when you're having some symptoms of kidney injury, pain. People are come because of the hard strokes from the pressure. Okay, some people come with a stroke for the first time. They didn't even know they have high blood pressure, and the pressure has already caused a stroke. They come pain in the eye, or they're not seeing well because the pressure is beginning to damage the eyes. Okay, they come with burning sensations all over the body, tingling sensation on the body because the high pressures are damaging the nerves. So by the time you're getting these symptoms, they're normally late. You have had high blood pressure for so long, and they've started damaging some of your body organs. So basically, we should know that high blood pressure will not give you symptoms, not until it is very late.
Can a person having a sporadic headache be the cause of high blood pressure?
Oh yes, on and off headaches. It's a common cause. I mean, high blood pressure is a common cause of on and off headaches. Most of the time, they wake up in the morning. You wake up in the morning with headaches, and most of the headaches tend to be at the back of the head. So somebody keeps waking up in the morning with headache, especially around the back of the head. We should start suspecting that probably they have high blood pressure. So these are people who need to make sure that every day they wake up, they measure their pressure at home. Okay, they measure the pressure at home, so that we monitor closely. Of course, there are so many other causes of headaches. Okay, so you need to try to identify the cause of the headache and then address it. But high blood pressure is one of the common causes of on and off headaches. Yeah.
Okay, and when does the blood pressure become an emergency?
Oh yes. Now, as I told you a little earlier, I said when you have high blood pressure, you can have damage to some of the organs in your body. Okay. We treat you as an emergency when you come into the hospital. When you've been brought to the hospital, you've had high blood pressure, and you're already getting what signs of damage to your organs. Number one is you come with severe headaches, confusion, because the high blood pressure is causing something called what encephalopathy. Okay, that is some damage to the brain because the pressure has been very high. Okay, number two, Some people will come with a stroke, as I said. Some people will come with pain in the eye, a lot of pain in the eye, or blurring of, not seeing well, blurring of vision, okay, because of the pressure. In those cases, we take them as emergencies. And normally, these pressures are very high when you come to the hospital and you're having those symptoms. They're very high. You're coming to the hospital because you're having already kidney injury, right? Because of the pressure, which is very high. We take that as an emergency, okay? You come to the hospital because you have had chest pains which are coming from the heart, because high blood pressure will damage the heart itself as well, okay? You come with heart attacks symptoms, okay? In these cases, we take them as an emergency because, number one, we have to make sure that we control this pressure as soon as possible. Then number two, we need to try to reverse the damage, or we try to limit the damage, further damage to these organs when these organs are being damaged because of your pressure. Okay. So in this case, we take you as an emergency, and you're going to realize that the doctors are going to do a lot of investigations and also tend to start giving you some injection form of pressure medications to make sure we control them as soon as possible. Then now, when you're a bit stable, we can be sent home later.
Thank you so much, Doctor, for that clarification and helping our viewer to get more information about hypertension and what they're supposed to do, the do's and the don'ts. I'm sure we shall be able to learn from it, especially on the lifestyle part. And we shall take a very short break, but we will be back with much more on this topic of hypertension with Dr. BENARD and from Misericordiae Hospital. Stay tuned. And in case you have any question from this topic, you can call us on 0717 424 866. Stay tuned.
Mater Hospital welcomes you to its newest satellite medical center at the Well Mall along Langata Road in Karen.
The reason why clients should come to Mater Karen Clinic or Medical Center is because we offer a variety of medical services, to include consultation services which are done by our qualified and experienced doctors.
We manifest the Spirit of Christ in the provision of healthcare to all our patients as we adhere to the values of the Religious Sisters of Mercy.
We provide basically primary healthcare services. So this means we'll follow up patients on an outpatient basis for various diseases, including diabetes, asthma, and any other illness which arises, which does not require complex care. Our staff are qualified and provide effective services which are cost effective and good for our patients.
The various services that we offer at our clinic include pharmacy services, where we have a fully stocked pharmacy run by a qualified pharmacist, and we serve all your prescription needs. We have laboratory services that are run by our qualified lab technologists.
Get more than just basic treatment at Mater Hospital Karen Medical Clinic.
One of the key features of primary care is that we provide health education about various conditions. This would include things like hypertension. We would advise you on things such as how to take care of your health.
We serve our clients within a very short time. We have enough well-ventilated waiting area for our clients. And we have rooms for all those procedures that we've mentioned, well-spaced rooms with enough facilities and equipment. We also have all the decentralized services that are offered from the main hospital, to include ultrasound services that we offer on Wednesdays from 8 a.m. to 5 p.m. in the evening. So feel welcome to Misericordiae Hospital, Karen Medical Center.
We take pride in your wholesome well-being. We are always ready to meet you at your point of need.
A lot of health issues are now preventable, and this means that just by making lifestyle changes, we can improve the health of people in the community.
Our esteemed clients and patients, welcome to the Misericordiae Hospital, Karen Medical Center.
We have a large, well-ventilated facility, which means that we are able to see patients in a safe environment. And I would ask you, if you have a health issue and you are within the area, please feel free to come and consult us. We're happy to work with you and identify your issue and resolve it.
We are open every Monday to Friday from 8 a.m. to 7 p.m. and every Saturday from 8 a.m. to 5 p.m.
You come and support us in this medical clinic in Karen, in the well. We are in the first floor. And you just test us. Sisters of Mercy are known for quality because they are all over the world, and especially our care for the sick. It is hard times because of the coronavirus, but we know we will give the best quality.
We just want to welcome all of you to come to our gynae clinic. It runs every Tuesday from 9 to midday. We have the full gynae specialty, all located in one room, one roof. We have a very comprehensive lab. We have ultrasound services, and most of all, we have caring staff who are going to take care of all your needs. So once again, welcome and karibu to this great medical center of ours.
Live discussion with Misericordiae Hospital, and it's brought to you by Capuchin TV in conjunction with Misericordiae Hospital, just to help you to have that concern when it comes to your health matters. And before we had gone for the break, we were talking about the hypertension, some of the causes and the types of blood pressure. And now getting back to this discussion, I'm sure every time we have a cause, or maybe we have a disease that is affecting person, it can be managed. We shall be able to get more information from the doctor, that is Dr. LANGO BENARD from Misericordiae Hospital. Welcome back. Yes, doctor.
Thank you, Maureen.
Okay.
Thank you, viewers. So, as we discussed pressure, we looked at that the commonest cause of the commonest type of high blood pressure is the type which is coming because of our lifestyle. Okay, the sedentary lifestyle and the dieting, and then also a few groups of people are predisposed genetically. Now, how do we manage these people? Since we said our lifestyle is one of the major driving factors, okay, in leading to high blood pressure. So, if you come to the hospital and we realize that your pressure is high, so the initial things I'm going to discuss with you, I'm going to discuss with details about how do you live your daily life, what is your work schedules, okay, what kind of work do you do? Is your work manual work, or your work involve sitting? Do you do a lot of running around at work or something like that? So that I can be able to estimate whether you actually do adequate exercise or not, because adequate exercise involves doing about moderate to vigorous exercise, okay? If I say moderate exercise, is exercise when you're doing, you're able to sweat a lot, okay? You're able to do some panting during the exercise, okay? You do go start breathing fast, okay? You feel like, okay, you're working the muscles, you're working the body. And during that exercise, you're not going to be able to sing comfortably, okay? You can only speak junks about the words. So this one, I will call it moderate exercise, okay? So if I discuss with you and you're not able to do this in your daily routine, then I would advise that the first thing you do is give adequate time, at least 45 minutes to 1 hour every day, either in the morning or in the evening after work, so that you'll be able to do this moderate exercise, okay, as a routine, because that's one of the core things is going to help you to manage this pressure, okay. Number two, we're going to discuss with you details about your dieting. What do you take every day? What do you like eating? So that we can be able to discuss how you modify these diets, because one of the important things you have to do is that you have to increase the vegetables you're taking in your daily diet. You have to increase the fruits you're taking in the daily diet, okay, because these things provide us a lot of roughages, okay, which will help you to reduce the cholesterol which you could have accumulated during your several years of eating lifestyle, okay. Modifying your diet is very important. Then from there, then we shall discuss how you're going to reduce things like diet. Too much salt in your diet, reducing salt quantity in your diet, reducing the amount of alcohol you take, because alcohol is known to contribute to to getting high blood pressure. Okay, because when you take too much alcohol, you tend to have constricted blood vessels. Also, the other important thing is smoking. People who smoke or take things like the drug abusers, things like cocaine, things like that. We have to go into details of all these things, not to arrest you on illegal drug use, but to help you out in solving your blood pressure problems, okay? Because if you don't look at all the details of things which are contributing this to this person having high blood pressure, you're not going to address it with medicines alone. So after looking at this into details, dieting, exercise, lifestyle, reducing the amount of things which are contributing high blood pressure, drug use, cocaines, alcohol, cigarette smoking, okay. All the other medications they're using, things like what we call NSAIDs, diclofenac. Some people take diclofenac, some people are using steroids. All these contribute people to having a high blood pressure. After discussing this, then we now got to start looking at what medications can I put you on, okay. We have several medications that we put patients on, okay. So the choice of medication depends on the doctor and also the evidence, which several studies always show in both blacks, whites, and things like that, what medicines work best, okay. We use guidelines which relies on the studies which have been found, which medicines work best. Then we start deciding, okay, let me start to put you on these two medications or one medication, coupled with exercise, the diet modification, okay, things like that. Then when you start on this medication, then you have to start monitoring your pressure every day. That means every day you should be able to record your pressure at home, okay, so that every 2 weeks or 1 month when you come to review you bring me a list of the recordings of your pressure, daily recordings, so that I can know whether you're on a good trend or you're not yet having well-controlled pressure. So when your pressure is well controlled on that medication plus the lifestyle you're following, then I know we're on the right track, okay. If you're not yet on the right track, your pressure is not controlled, we keep adjusting these medications until we meet our targets of normal blood pressure, okay, because that's a target of treatment, is to make sure your pressure is in the normal ranges, to avoid damaging your organs. Otherwise, if you don't do that, if you don't meet the target, then we are not yet we are still causing organ damage, okay, much as you're on medication. So basically, this is how we manage high blood pressure, okay. So we don't choose only one thing. So don't take medication, then you say, since I'm taking medication for pressure, I'm safe. No, you're not safe. You're supposed to combine with these lifestyle modifications that the doctor has discussed with you into details, okay? And these people tend to do very well if they follow these all these instructions.
Does it mean we have to start hitting the gym?
Oh yes, very important. You don't need to eat the gym because not everyone can afford the gyms, okay? Because gym is expensive. So anything you can do to make sure you sweat a lot, to work your muscles every day, that's what I encourage us to do. So you can decide to jog around your house, jog in your own room, run around your room, jog along the roadside, go swimming, ride a stationary bicycle, or riding a bicycle itself. So anything you can afford which can make you work your muscles, That is what we discuss with you. And any kind of foods, any kind of healthy foods that you can afford, because not everyone can buy all the fruits that you're advising them to buy. Okay, so we need to look at the financial ability of this client, and what they can afford to do. So because all of us can manage to do something which will eventually make our pressure become normal. Okay. Yes.
You know, doctor, this topic is very interesting. We are having it on Friday, and you know, on Friday, the Kenyans, they describe it as party after party. So it's a good thing they have to take some of the few notes. Yeah.
Actually.
And okay, you want to say something?
Yeah. So on Friday, please reduce the amount of alcohol you're taking on Friday, because and amount of cigarette you're smoking, because just know that those things are contributing to your pressure going up eventually.
Yeah, because you might be saying you are having fun and yet you are bringing some problems to your life.
Exactly.
And why is it most people who have high blood pressure have diabetes?
Oh yes, so the important thing is that pressure and diabetes, they have similar risk factors. Okay. 2 weeks ago we discussed diabetes. We realized that what we're discussing right now, it's quite similar to the same thing we discussed last week of the risk factors of high blood pressure and the risk factors of diabetes. They share the same risk factors. Okay, the lifestyle and the dieting. Number 2 is that when you have diabetes, I have a lot of inflammatory process going on in my blood vessels. Okay. Number 2, I have a lot of circulating fats in my blood vessels. Okay. Now these things, much as the worsening diabetes, they also put you at risk of developing high blood pressure. Okay. So the same mechanism is taking place to drive you to getting diabetes, drives you to getting high blood pressure. Okay. Things like obesity. When I'm obese, the same thing will happen. Okay. I have more risk of diabetes, I have more risk of high blood pressure. Okay. So the mechanism is similar, the risk factors are similar. That's why these things tend to come together. Okay. So each time I have high blood pressure, I just know I have to monitor this client very closely for diabetes.
And do children get a high blood pressure?
Yes, they do. They do. Now, the high blood pressure, the type we're discussing, which we say is a lifestyle high blood pressure, children are also getting these days because our diet have greatly changed. Our lifestyle has greatly changed. Even children are getting extremely obese these days. So we have gotten people in the hospital, children in the hospital as low as 18 years, 17 years, whose pressure are so high. They're extremely obese, the pressure is so high. So much as we expected this to come in adulthood, children are also getting high blood pressure, and it's increasing. But normally, high blood pressure, the type which is more common in children, is the type which is secondary to some other diseases. Okay, what I was trying to discuss earlier. When a child has some other diseases, kidney failure because of some other problems, polycystic kidney disease. Okay, they have other tumors in the tumors, what they call tumors or cancers. We could normally call them cancers in public, but any tumor which is driving your kidney bad, okay, it can make the child start developing high blood pressure. Okay, not necessarily because of lifestyle. So there are so many, these secondary types of high blood pressure. It's more frequent in children, but also because of our lifestyle, even the primary hypertension is getting more and more in children. Okay, but the commonest age for high blood pressure, like in Nairobi or Kenya as a whole, usually between 30 up to 50 years. Okay. Yeah.
And nowadays, when you visit to the hospital, you normally, the first point that you're sent is checking the high blood pressure, your pressure. What is the importance of being checked, and how often should we be checked at the high blood pressure?
Oh yes, daily is the best. If I check my pressure every day, that's when I can easily know that I'm developing high blood pressure as early as possible. When you go to the hospital, we do routine checks because it's very important. Number one, in gauging whether your sickness is related to pressure or not. Number two, we record your pressure plus other vital signs to know how severe your sickness might be. 3, also to screen, make sure that we don't miss high blood pressure in you, so that we can always advise you early as possible. That's why we do routine checks for everyone. It's very important that we do this in helping us in advising patients early, and also proper management of the patients. Yeah.
Okay, and I don't know if it's a myth or is it true or it's just rumors. Is it true that COVID-19 is related to or people having high blood pressure are at higher risk being exposed to COVID-19?
Yes, the point is that people with high blood pressure are at a higher risk of getting severe form of COVID. Okay, when you have high blood pressure, studies have shown that the preliminary studies which are ongoing, and some of the findings, they've realized that COVID uses some sort of receptors in our body. Okay, these receptors, they are more common in people who have high blood pressure or diabetes. So when I have these receptors, which COVID is going to sit on to infect my body, and if I have a lot of these receptors, that means I'm likely going to have severe COVID. Rather than somebody who doesn't have these receptors or has very little of these receptors, chances are high that they're going to have less severe infection from COVID. That's the relationship so far they've found. And also the second thing is that we realize that when you have COVID, chances are high that your pressure is going to start going higher and higher. Okay, with poor control. Your pressure could have been well controlled, then you start having high pressures. Or if you didn't have high blood pressure, your pressure may start rising up. So these are relationships so far we have realized with COVID. Okay.
And we have one question from Linus Mariga, and some of them we have tackled. What is hypertension? And then he says, hi, can you ask the doctor for me who are most at risk of getting hypertension and at what age? And maybe he can touch on diet for people with high blood pressure.
Oh, yes. Yes. Thank you very much for asking that question, Mr. Mariga. The other parts of tackled. So what I want to, on that question, what I want to tackle is the important dieting for people who have high blood pressure is, number one, we advise you to reduce on the salt intake. Don't take very strong salt in your food every day, because salt, where there's salt, water flow follows. So when you take too much salt, you're going to drink too much water. When you drink too much water, your blood volume is going to go up. When your blood volume is much, the pressure in your body the pressure in your blood vessels is going to go up. Okay, so reduce on the salt intake. Number two, we want you to reduce on the amount of animal fats that you're taking, because animal fats tend to have a lot of, these fats have cholesterol. Okay, now high amount of cholesterol is associated with high blood pressures, okay, or poor control of pressures, because your blood vessels tend to get clogged up with these these products, these fatty products. And when your blood vessels are clogged up, that means the pipes are going to be narrow in size, and then the pressure of the blood flowing in these pipes are going to increase. We advise you to increase on the amount of roughages. Roughages, we know roughages are so much in fruits, roughages are so much in vegetables. Okay, roughages are known to reduce cholesterol in your body, because once you eat too much roughages, okay, then when it reaches your intestines, the cholesterol, which is, the products from your liver, which is coming via your gallbladder to your intestines, they have cholesterol in them. Normally they are reabsorbed back during digestion. Okay, but when you take too much roughages, when these things are secreted out with cholesterol coming also, then roughages block the reabsorption. Then that means you're going to keep eliminating the amount of cholesterol in your body. You're going to start reducing the amount of cholesterol in your body slowly like that. Okay, that's how roughages help us in improving our pressure control. Okay.
Right.
Yeah, so these are just some few highlights of the kind of diets we advise you to eat. Okay.
Okay, thank you so much, Doctor, for sharing a lot of that information to our viewer, and also you are educating us too, because each and every day we learn. It's a learning process. And before we wind up, because I know time is not on our side, when a person, maybe a person is suffering from high blood pressure, or they have a relative, how can they reach to you as Mater Misericordiae Hospital is concerned?
Oh yes. Thank you very much, viewers. The important thing is that we have so many outlets of Mater Hospital right now. We have so many satellite clinics, okay, from Karen this side up to the side of Juja, up to this in Westland side, Buruburu side. So the branches, the outlets are so many. So the outlet which is closer to you, try as much as possible to reach these outlets so that we can screen your pressure and give you a good teaching for how you're going to improve your lifestyle to prevent you from getting into very high blood pressures. Okay, and if your pressures are very high, we shall also advise you on the appropriate treatment that we have to take. Okay, then the exercise, how you can do the exercise, we discuss with you these things in details. So you can reach us in any of the outlets, also as well as the main hospital. Number two, we always have outreach programs, okay? Screening outreach programs. We go to several areas of Kenya. So whenever we get an opportunity, whenever you hear of Mater getting close to where you stay, don't hesitate to reach these outreaches, because they're very important in screening some of the illnesses that you may have and you may not be aware, so that we can help you early as much as possible. You can always call the hospital. We have hospital helplines available. I think usually, you can provide these helplines later, but you can provide you can call the helpline of the hospital for any advice, because we have offer this advice to help our population to improve. Okay, so this is how you can reach Mater Hospital. As we're also discussing here, every Friday we always come here to give these health talks, so that we can reach the public for any clarifications. Okay. So now, as I wind up, what I want to say is that high blood pressure is a lifestyle disease, basically lifestyle disease. When we improve our lifestyle in terms of the dieting, in terms of exercise, we are going to reduce the incidence of high blood pressure. Okay, because right now it's on the rise in Kenya. Yeah.
Thank you so much, Dr. LANGO, BENARD, for sharing all that information. And to our viewer watching, you can try, and you don't have to do a lot of the lifestyle, but you can improve every day, each and every day. And hoping that you are going to follow about that. Thank you for staying tuned to this discussion of Health Talk with me, Maureen Kimani, and our guest, that is Dr. LANGO BENARD from Mater Misericordiae Hospital. Have a nice time.
Mater Hospital welcomes you to its newest satellite medical center at the Well Mall along Langata Road in Karen.
The reason why clients should come to Mater Karen Clinic or Medical Center is because we offer a variety of medical services, to include consultation services which are done by our qualified and experienced doctors.
We manifest the Spirit of Christ in the provision of healthcare to all our patients as we adhere to the values of the Religious Sisters of Mercy.
We provide basically primary healthcare services. So this means we'll follow up patients on an outpatient basis for various diseases, including diabetes, asthma, and any other illness which arises, which does not require complex care. Our staff are qualified and provide effective services which are cost effective and good for our patients.
The various services that we offer at our clinic include pharmacy services, where we have a fully stocked pharmacy run by a qualified pharmacist, and we serve all your prescription needs. We have laboratory services that are run by our qualified lab technologists.
Get more than just basic treatment at Mater Hospital Karen Medical Clinic.
One of the key features of primary care is that we provide health education about various conditions. This would include things like hypertension. We would advise you on things such as how to take care of your health.
We serve our clients within a very short time. We have enough well-ventilated waiting area for our clients. And we have rooms for all those procedures that we've mentioned, well-spaced rooms with enough facilities and equipment. We also have all the decentralized services that are offered from the main hospital, to include ultrasound services that we offer on Wednesdays from 8 a.m. to 5 p.m. in the evening. So feel welcome to Mater Misericordiae Hospital, Karen Medical Center.
We take pride in your wholesome well-being. We are always ready to meet you at your point of need.
A lot of health issues are now preventable, and this means that just by making lifestyle changes, we can improve the health of people in the community.
Our esteemed clients and patients, welcome to the Mater Misericordiae Hospital, Karen Medical Center.
We have a large, well-ventilated facility, which means that we are able to see patients in a safe environment. And I would ask you, if you have a health issue and you are within the area, please feel free to come and consult us. We're happy to work with you and identify your issue and resolve it.
We are open every Monday to Friday from 8 a.m. to 7 p.m. and every Saturday from 8 a.m. to 5 p.m.
You come and support us in this medical clinic in Karen, in the well. We are in the first floor. And you just test us. Sisters of Mercy are known for quality because they are all over the world, and especially our care for the sick. It is hard times because of the coronavirus, but we know we will give the best quality.
We just want to welcome all of you to come to our gynae clinic. It runs every Tuesday from 9 to midday. We have the full gynae specialty, all located in one room, one roof. We have a very comprehensive lab. We have ultrasound services, and most of all, we have caring staff who are going to take care of all your needs. So once again, welcome and karibu to this great medical center of ours.